you've actually said that the dysanaesthetic state might be an appropriate target or endpoint for general anaesthesia.
Yeah, and again that was based on the results from the literature review that certainly with the more modern day techniques, rather than those instances where IFT had been used to detect true awareness, you could say, where they were getting appropriate doses of anaesthetic, that the patients were responsive but did not have traumatic post-operative experiences, or indeed memory for the surgery.
No.
Some of them remember the questioning, but they didn't actually remember the surgery. So
but the difficulty with that, of course, is that just might be just an amnestic effect rather than something to do with.
It could
how
be a
they were
specific
Yeah,
amnestic
yeah,
effect.
yeah.
But when they did remember, they did recall the command, but not the.
Yeah.
You know, so
Sure.
it was very specific to
Yeah.
that. So I went out on a limb and actually said, well, in a sense, I was saying crudely what I think you are hopefully going to say much more in a much more sophisticated way, which is really it's acceptable so long as or because you cannot create a mental model of
Given where we are right now, if you needed to have a general anaesthetic, would you be happy if your anaesthetist said, "I'm going to aim for dysanaesthesia"?
I would be happy in a curiously, out of a sense of curiosity. I would be fascinated to have that experience, and sadly I haven't had it. I've tried, as it were, with dosing regimens and so on, but I haven't had it. But I would like to.
But you might have had it. But not.
I might have had
amnesic.
I might have had it and been amnesic, but of course I haven't had muscle relaxants.
No.
So I wonder if there is a story there that yes, the muscle relaxants are not only creating the catastrophes and so on, but also they're actually somehow encouraging that state.
Let me put the question to you in a different way. If your son needed a general anaesthetic and you knew the anaesthetist and you happened to know that his target endpoint was dysanaesthesia,
assuming we could reproduce it, I think I would. I think I would say to my son, look, this is the experience you'll have, it's called dysanaesthesia and it's fine, and that's what happens, and it's safer than the alternative.
Okay.